constipation is defined as a reduce in stool frequencies, and also other related symptoms such as having hard stools, they're having difficulty in passing stools, and also if they're having the feeling of incomplete evacuation of the stools in the rectum. In Ministry of Health, my portal website, it was mentioned that the overall prevalence of constipation in elderly population in Malaysia is about 24 to 37%. So there was about 1 in 4, 1 in 5 in elderly populations. And it's also mentioned that 60% of them is using laxatives. Chronic medications are well known, such as diabetes, hypertension, high cholesterol levels, and also some other conditions such as Parkinsonism, hypothyroid, and also those patients like who suffered stroke. Those who suffer stroke, they have this reduce in mobility. It's like they reduce the movements. So all of them do at some points complain this constipation and all the related symptoms like I mentioned before, the hard stools, the reduce in frequency, the feeling of incomplete evacuation of their stool, and also some of them they have this sensation of feeling of blockage in the anus or rectum. These elderly populations, elderly people, they have those multiple chronic medical conditions, which they are taking lots of medications, and even due to their underlying medical conditions, which slows their bowel motion, such as like diabetes with neuropathy, they have the problem with constipation as well, the reduced sensation in terms of reduced bowel movement, reduce the feeling to evacuate the stools, and even like I mentioned before, when they having all these age-related or medical condition, they have the reduced immobility. So all these factors become challenging when we are trying to treat them. So at the moment, most of the healthcare providers, we are aiming for increase in terms of, in treating constipation, we aim to increase the stool frequency, and also we aim to evacuate the hard stools or stool blockage. So it's either we using laxative or we using the stool softeners, right? But most of them, by using all these medications, it does not give any satisfactory improvement in terms of the symptoms. It can just relieve temporarily, but the problem stays there. You need something that can actually help to reduce not only the blockage of the constipation, the blockage of the stool in constipation, we need to also tackle all the other related symptoms. I read some of the previous studies that show probiotics do have certain roles in helping patients with constipations. But most of the studies they conducted in healthy individuals, not in the elderly population specifically. Those studies, it showed that these probiotics have a proposed mechanism that it can help constipation in the concept of they modify and also stabilize the gut microbiota. The microflora in our intestinal systems. So in which then they have an effect in terms of regulating the bowel movement and also improve the bowel motility. So several studies also documented that probiotics, at the end, it improved the whole gut movement or transit time, the stool transit time in the gut. On top of that, it also improved the stool consistency, become less hard, becomes more soft, and it's at the same time it improved all the constipation related symptoms like I mentioned before. So that's why my aim in the study was actually to find whether these probiotics can help in the elderly populations or not. It has been shown have a good effect in other studies which only conducted in the younger and also much more healthier populations, but no specific study at that time to show that it also helps in the elderly, which is my targeted study populations. So that's why I conducted the study. The study was designed as a RCT, a randomized control trial, placebo control, 1:1 ratio. And it was conducted according to the standard guidelines in the Good Clinical Practice (GCP). For the subjects of the participants, the subjects were recruited from the medical outpatients clinic in the University Kebangsaan Malaysia Medical Center in 2017. And it was, in my study specifically, we're looking at the elderly group of people aged more than 60 years old with at least 2 medical conditions, and they must have the constipation symptoms, specifically at least two out of all the other symptoms, at least 2 symptoms of reduced in stool frequency, less than 3 times per week. They complain of having hard or lumpy stools, and if they have this feeling or sense of incomplete evacuation during bowel movements, or if they have the sensation of blockage during defecations, or even we also taking consideration into those patients who have the need to manually evacuate the stool in the rectum. So all these patients became the subjects, and we randomized them into 2 groups. One group receiving placebo, and the other group receiving the probiotics. And the probiotics that we choose is actually the microbial cell preparations, which contain the 6 strains of the lactobacillus and bifidobacterium probiotics. During the study, we conducted them to took the samples twice daily for a duration of 1 week. In terms of measurement, what we did is we are looking at the outcome, primarily looking at the reduction in stool frequencies and also stool consistencies. So we asked all the participants we taught them actually to fill up a stool diary, a simple stool diary with charts on daily symptoms. So throughout the days that they're taking the probiotics, they will have just to marking in the charts whether the symptoms improving or not, whether they have the bowel motion or not. And based on the stool diary, we collected all the data and we calculated all the results, and we able to see whether based on our intervention with these probiotics and also intervention with the placebo, we compare them together, and then we see which is actually more likely, or does it have any effect on their daily complaint or daily symptoms which related with the constipations. Interestingly, in my study, in my randomized control trial study, it shows that significant results in terms of our primary outcome that we're looking for. The subjects who took probiotics the microbial cell populations with the lactobacillus and bifidobacterium. They showed from the stool diary, they have improvement in terms of stool frequency more than 3 times per week, and also in terms of the stool consistency. Both of these two outcomes, by calculation, it shows a significant improvement compared to the subjects who was randomized to take the placebo group, to take the placebo samples, which doesn't show any improvement in terms of their stool frequency and also in terms of their stool consistency, which remain the same. So although the application of this trial is just 1 week, it's already showed a very good significant data based on the stool chart there. The other good thing is from our trial, they have no adverse events, especially for those who were subject to take the probiotics. They haven't complained of any issue, even the smaller issue, towards the probiotics. I believe because of the microbial cell preparations, also very simple to be applied, very simple to be taken to patient, is also have an orange flavor which is very tolerable to most of the patients, even in elderly. For additional tip, I think it's a general rules for not only for elderly, even for those younger population like us. We always being advised to have a good dietary. If we have to take high fibers, such as the bran, the whole grains, the vegetables. So, and all these good fiber intakes actually helps in terms of having a good bowel motions daily. It also advisable for us to take more fruits such as prunes, the melons. Apart from diet, we have to have adequate fluid intake. If we lacking taking fluids, it's contribute to the constipation. And on top of that, we have to be active, regular exercise. Even for those, for if we have the elderly patient, we advise them to keep healthy by being mobilized, perform any simple exercise, because mobility do stimulates the defecation, stimulates our gut movement. We still advise patient, if needed, they can still continue taking all the necessary medications such as the laxative, the stool softeners, but the usage of laxatives should be judiciary. The most important thing is we still need to treat the underlying medical conditions. So do not stop treating the underlying medical conditions, because it also actually will help in terms of treating all the related complications.